Hello, everyone. Welcome to Lump Basics. Let's welcome our first presenter, Ma'am Needs You, certified acupuncturist of Silang, Cavite. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector, and good afternoon, classmates. So, ng basics pa tayo. Entry and exit points, day 2. Okay. Blocks in the energy flow in the superficial energy circulation. Block between exit and entry points. We always take energy blocks seriously, especially along the meridian flow. Many surgical scars can cause blocks, creating saturation of energy and pain on one side of the scar, yung scar peclat, and numbness and emptiness on the other side. Needles need to be inserted on both sides of the scar on the meridian in order to balance the block, okay? On the organ clock, these blocks are possible even without a scar. Some of the exit and entry points are quite far away from each other. Katulad ng liver 14, the exit point of liver and the entry point of lung, yung lung 1, have at least 6 June between them. It is quite possible the energy can be lost and stagnates between these 2 points. And then what is the result? There is pain, a feeling of pressure on the chest area, and if this is over the left side, it is nakakatakot, similar to angina pectoris. Okay. So here we have a clinical example of a patient, female, 54 years old. This patient was admitted to emergency ward in the hospital with chest pain and was under observation. Electrocardiogram tests and blood reports showed no evidence of cardiac damage. The blood pressure was slightly elevated. Yung pain was over the left side of the chest and over the breast. Not only was the pain radiating to the little finger of the left hand, there was a great amount of tenderness over the chest area. Okay? May malambot sa may chest area. Treatment? Yung 3 yin meridians of the leg terminates at the thorax. And the 3 yin meridians of the arm begins here. So the distance between their exit and entry points is quite long. All 6 needles were placed on the left side only, and then only the exit points were softly vibrated every 10 minutes for just a few seconds. After the first 10 minutes, the tenderness was better. In the second 10 minutes, the pain and pressure improved greatly. Within half an hour of insertion of needles, the patient was 95% pain-free. Yay! The treatment was repeated the next day and the patient was discharged the same day quite well. Okay? Ang ginamit ng mga points, liver 14, binibrate from time to time and lung 1. Kidney 22, vibrated from time to time and pericardium 1. Spleen 21, vibrated from time to time and heart 1. Okay? So, needles were left inside for 30 minutes with the exit point shortly sedated every 10 minutes. So remember po kung paano ginawa. The young meridians end and begin on the face. The space between points LI20 to stomach 1 can often be a trigger point in trigeminal neuralgia or TMJ. The space between point SI19 and GB1 or between points triple warmer 21 and GB21 can be the center of the pain areas in migraine headaches. Okay? Treatment is very simple. And if this block was the true reason for the pain, the symptoms should ease during the first treatment session and disappear completely within 2 to 3 sessions. Okay? Many of my colleagues think, sabi nung author, think that energy balancing is complicated and difficult to grasp. Mahirap daw. Pero sabi niya, I often tell them to think of the more simple explanations to start with. If there is pain in an area, it does not have to be due to a great imbalance. It could also be because there is a block on the path along which energy is flowing, may bara. On unblocking or removing the offending block, tatanggalin yung bara, then magkakaroon ng smooth flow ulit. Okay? Yun. There are many reasons for the formation of plaques, pwedeng surgical scars, long distance between exit and entry points, or an excess situation in the meridian ahead, tumors, etc. Pero yung lahat ng blocks ay hindi pare-parehong pagtitreat, okay? For instance, a scar is treated by placing 2 needles on the meridian. It is not necessary acupuncture points. Basta nasa meridian, both above and below the scar. If the meridian ahead has an excess situation, then this meridian should be sedated. So ito, may illustration po sa example. So ang example dito, yung nagkaroon ng cesarean operation. The ren meridian and kidney meridians unblocked after a cesarean section. So tingnan niyo po kung saan inilagay yung mga needles. Okay? Okay, yan po. Observe niyo po mabuti. Thank you po very much again, everyone.
Thank you very much, Ma'am Neets. That was very helpful. Let's now go to our second presentation. And let's welcome Ma'am Teresita Sumile of Rizal for her presentation, for tongue proper. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Now let's study about tongue proper. Here we could see a picture of a normal tongue which is divided into 3 major sections called the triple warmers. Upper warmer, which can be found at the tongue tip, represented by the lung and the heart. The middle warmer, which can be seen in the central area of the tongue, represented by the spleen and stomach. The lower warmer, which can be found at the root of the tongue, represented by the kidney and urinary bladder. Then the whole size of the tongue is represented by the liver and the gallbladder. A normal tongue should be pink in color with a thin white coating. It should not be too broad or too narrow, not too flat or thick, and should be moist without mucus and not dry. There should be no red papillae or blue color on the tongue. It should be protrude directly forward and not be deviated. There should be no tremor on the tongue unless the patient has to hold it out for too long for the doctor to examine. Okay? This refers to the size and form of the tongue, the color, and the moisture. It shows us the state of the blood energy and body fluid in the various organs of the body. The state of the tongue proper reflects the interior energy situation of the body. The color changes could be localized or generalized. Local changes show problems in an organ. General changes show problems in an area or one of the triple warmers. The tongue proper does not change quickly. These changes are more serious and show the fundamental tendency of the body. This is the actual coating in the tongue that cannot be brushed off or removed. You should not confuse this with food stains and coloring, so let's take note of this. The tongue coating shows the different climatic pathogenic factors that are attacking the organs from the exterior at that moment. The abnormal changes in coating should be localized or generalized depending on the size of the affected area. The tongue coating should change rather quickly, sometimes even during a single day. The changes are not too serious, though if neglected, the pathogenic factor in the exterior could attack and descend to the interior. Now let's go to the pale tongue. Generally indicates cold symptom. Could also be because of blood deficiency in the heart and liver. It is common to see paleness in the whole tongue or just on sides or on the liver area. Now, red tongue indicates heat in the interior. Again, It is possible to see the entire tongue red or just red on the sides, in the liver or tip. Then deep red tongue shows fire hits in the interior. This fire hit could be localized, but if it is often a generalized symptom, it tends to appear in a very dry and heat combined state of the whole body, also with little or no coating and possible cracks, similar to the appearance of dry and cracked earth. Okay. Next is purple tongue. It is a blue-red color, indicates stagnation of blood with poor circulatory function in the heart, liver, or spleen. It commonly appears in the whole tongue in heart insufficiency or severe bradycardia, on the sides in a liver Qi deficiency, and in the middle of tongue in spleen Qi deficiency. Next is large loose tongue, also called flabby tongue. This refers to the flabby or loose appearance of the tongue, often with teeth marks. The teeth marks show edema on the tongue caused by stagnation or retention of body fluid, relating mostly to the spleen or seldom to the heart or kidneys. These marks are always a sign of spleen Qi deficiency, whereas the largeness of the tongue is an indication of the nutritional storage of spleen, particularly spleen blood, and stagnation of dampness. So, a very large tongue with teeth marks will show excessive dampness in the spleen. A moderate-sized tongue with teeth marks will show not so much stagnation of dampness, while a small tongue with teeth marks will be more a sign for blood and Qi deficiency in the spleen. Just as one could have edema as a symptom of malnutrition, there could be teeth marks on the tongue in any state of spleen yin where the function is deficient. So let's take note of this. Yolampo, thank you so much for your attention.
Thank you very much, Ma'am Teresita. Let's now listen to Ma'am Mildred Digma, certified acupuncturist of Apayao,
Hello
for
po muli.
needling techniques. Good afternoon po, Ma'am Mildred.
Gandang hapon po muli. So, our topic, needling techniques, number 30 na po tayo. Yung example po dito, pag mayroong acute, chronic, or pneumonia. So, yung bleeding cup on the backshoe point of lungs. So, yung backshoe is urinary bladder 13. And any other backshoe points on the posterior surface of the lung that are tender to touch. So, kailangan kinakapa po natin pag may matigas yun din po, pwede nating i-bleed. Other symptomatic points for cough and fever can be given at the same time. Sa paalala lang po kung gumagamit tayo ng bleeding cup, so balikan natin yung mga tinuro kasi hindi rin basta-basta po tayo nag-bleed. Hindi po tayo basta nag-wet cupping. Then, chronic bronchitis with dry, urgent cough, and low fever, grade fever, night sweating. So, the same procedure po ang pwedeng gamitin, this time with symptomatic points. So, pwede tayong pumili ng mga points, symptomatic points para sa ubo, and lung yin tonification. So, syempre, yung lung 9. Yan po yung mga points na nagpapalakas ng baga. Acute cholecystitis with pain and fever. So, yung cholecystitis po yung pamamaga po yan, mga redness swelling ng gallbladder. So, kaya ginagamitan natin ng bleeding cup kasi paaalisin pag may mga redness, hit po yun. Kaya pag gumamit ka ng bleeding cup, lalabas po yung init. So, pwede po natin gamitin yung urinary bladder 19. Yan po yung backshoe point ng gallbladder. So, along with gallbladder 36. Ito naman po ay C-cleft point. Pwede rin pong gumamit ng extra point ng gallbladder. Ito yung gallbladder 34. 1 tune below gallbladder 34. Extra point ng gallbladder. So, ear acupuncture points po, yung gallbladder, adrenal, and Shenmen. Hanapin po natin yan sa part ng tainga. Pag mayroon naman pong chronic pancreatitis with pain and diarrhea, yung pamamaga naman po ang pancreatitis ng pancreas. Yan, namamaga, namumula din po siya. So the patient is usually very thin and underweight. Oh. Ingat po tayo pag mag-bleeding tayo, yung bleeding cup. Kasi kung very weak, pag sobrang hinang-hina po, hindi po pwede. Siguro gagamit kayo ng ibang pamamaraan ng panggagamot. So, pero kung kaya naman po niya at makita ninyo, pwede po yung bleeding cup on extra point ng pancreas. So, ito po yung 1.5 tune. Lateral to enter space of thoracic vertebra. Yung thoracic po, 9 or 10 vertebra po yan. So, magre-release po siya ng heat. So, para dun sa inflammation. Pag may spleen blood and function could be tonified with points liver 13 and urinary bladder 20. Kasi urinary bladder 20, backshoot points ng spleen. And then yung liver 13 ay pampalakas din po ng nagtotonify ng blood. Then, pwede pong gumamit ng symptomatic points for diarrhea. So, yung stomach 36 natin. Local points for abdominal pain can be used simultaneously. This example illustrates the bleeding cup on backshoe points of organ only release heat and do not affect the functional chi. Therefore, it becomes possible to use them in both excess and deficient state of the organ. So, pag ginamit mo yung bleeding cup, pwede ka pong nagtatanggal ng mga excess condition tulad ng sobrang init na nasa katawan at pwede rin pong mapalakas mismo yung organ. Kasi kung nawala na yung heat, syempre lalakas yung organ. Bleeding cup method of treatment is contraindicated in patient on anticoagulants. So kung may mga iniinom po siya, may mga sakit sa puso na may anticoagulants medicine, bawal po ang bleeding cup. Then ito naman po ay plum blossom needle tapping therapy. So tinatap po siya. Parang hammer siya, maliit na hammer. So gets its name from the many short needles protruding from it. So may mga needle po yung dulo niya, maliliit lang. So resembling the petals of the plum flowers. Parang an example nila sa plum flowers. It is used for tapping the skin. So itatap mo po yan sa skin, dahan-dahan lang. Or medyo may bigat. This is scattered superficial needling treats the cutaneous area of meridian. As a climatic pathogenic factor can enter the body to this area when the immune system is not sufficiently strong to eliminate them. So kung mahina yung immune system, yun, itatapunin nyo yan para tulungan siya i-release yung heat na pumasok sa katawan. So, isa pa po doon sa plum blossom needle tapping therapy, pag light tapping po, so this is used to cause a red reaction of the skin. So, namumula po yung skin, Local light tapping is used to increase the blood and energy flow in the area. Kaya mamumula siya dahil matutonify mo yung, parang nagagalaw mo din, magpo-flow yung dugo doon. In the area of local numbness, yung may mga pamamanhid, on the area with vitiligo, around the eyes, and short-sighted in children. So, careful lang po dyan, Paravertebral line, tapping 1 centimeter, lateral to the midline. Is used for stimulating the function of internal organs in the area. So, yung mismong internal organ po dun sa area, ang inyo nang pinapalakas and stimulate yung pagdaloy ng dugo. For treating back or neck pain. Heavy tapping, so ginagamit naman po ito, nag-bleed pa po ng skin. Pag medyo malakas na yung pagtatap mo, dudugo po yun. So, another method of releasing heat. Sabi nga natin, pag pinapadugo, pag tinatap mo, lalabas yung dugo. Neurodermatitis, para po sa may mga neurodermatitis. Ito yung mga makakati na mga skin, na mga parang sa Tagalog garot na sobrang kati. So, local tapping to bleed for releasing wind heat. Yung mga may psoriasis po with itching and bleeding. So, kailangan po ng bloodletting will help help let out the harmful pathogenic yang, yung may mga matatagal ng psoriasis. So, palabasin ng init sa pamamagitan ng pagpapalabas ng dugo. Ganon din po yung may mga hair loss in areas. So, yung flam blossom bleeding po for the first 14 days of treatment will help her grow again. Tumutubo po ulit yung buhok. Yan. But as the first hair appears, flam blossom tapping should be stopped and electrical stimulation given. So kung sa first pa lang pong pagtatap nyo, per session, may tumubo ng buhok, stop na po yung tapping. Ang sunod na raw pong gamitin ay meron ng electrical stimulation. Yung mga needle na kinakabit na natin na stimulator.
Saka pinapadugo, no, Ma'am Mildred? Interesting. Okay.
Magkakabuhok.
Yeah.
Magtatap-tap.
Actually, mura lang ang plum blossom, di ba? Plum. Ang tawag...
Try mo na, Doc.
Yes, pero yun nga, you need to buy a new, kasi lalo na...
Needle.
Yeah.
Every time po papalitan.
Mura
Napapalitan
lang
po siya ng needle or yung head mismo ang kailangan lagi kang may bago.
May mga mura naman, oo. Pero disposable siya. Oh, it's giving me...
So, pangtulong po yun pag hindi na gumagana yung mga points natin, mga major points para sa pagpatubo ng buhok, siyempre kidney.
Pero kung gagamitin mo sa sarili, hindi mo kailangan palit-palitan, di ba?
Opo, pag ikaw lang po. Na lang, disinfect.
Sa yung mga
disinfect
dyan.
Na lang, Doc.
Yes. Okay, let's give that a try, no? Yung mga nakaka-relate din dyan. I'm sure marami. Di ba?
Pero pag tinusukan mo, Doc, yung kidney, mabilis din tumubo ang buhok eh.
Actually, nung araw na iba yung tumutusok, plus yung kidney 7 talaga, you need to tonify kidney.
Opo.
Nakakatulong.
Kasi ako, Doc, na-try ko din.
So,
yung mga
yeah.
Nakakapagpatubo talaga ng buhok.
Totoo.
Tapos tutulungan mo ng BCO, imamassage ng BCO.
Okay. Sige, mag-usap tayo niyan, Ma'am.
Alternate.
Okay. Thank you very
Thank you
much,
po.
Mildred. Okay. Now let's call Ma'am Teresita Sumila once again to continue her discussion of the earth element, diseases and symptoms. Good afternoon ulit, Ma'am Teresita.
Yes po, Doc. Good afternoon ulit and good afternoon din sa mga kaklase ko po. Now let's continue our studies on diseases and symptoms of heart element. Chronic recurrent gastritis. Not every ITIS has to be a heat disease. Recurrent heat symptoms could arise from two causes, from dryness or from stagnant dampness. Both the associated symptoms and the treatments are very different for the two causes. Okay? Now we have stomach fire or heat. Manifestations are a thin person, often hungry and thirsty, stomach empties quickly after meals, small appetite, intolerance to hunger, pain when hungry, improves after eating bland foods, reflux of acid, prefers cool drinks, pain worse during stress or worry, foul breath, red tongue, yellow or no coating, dry or cracked in center, and thin superficial pulse and rapid. Treatment, Ren 12, pericardium 6, gut 20, liver 1, and stomach 43. Then, advise po natin ang patient to eat fish, poultry, and milk products. Avoid strong flavors. Reduce coffee. Di mabasa. And alcohol intake and smoking. Then we have also stomach damp heat and stomach chi deficiency. Manifestations are obese person, thirsty only with meals, stomach empties slowly after meals, big appetite, and has sweet craving. pain after eating, better when empty. Then there is also reflux of food and acid, prefers warm drinks, pain worse at night, after big meals or after heavy meals. Large tongue with teeth marks and has thick white slimy coating. Then the pulse is full and slippery. Treatment, UB21, pericardium 6, spleen 9, and stomach 40. Patients should eat small meals, cooked and warm. Then there is no refined sweets or carbohydrates or fats and milk products. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We now proceed to acupuncture, general principles of acupuncture treatment. And let's call Ma'am Lynn Galarita for the presentation. Good afternoon, po.
Good afternoon, everyone. Now we're on our third part of the general principles of acupuncture treatment. For today, we'll discuss on the third general principle, which is distinguishing primary from secondary. Between antipathogenic qi and pathogenic factors, the antipathogenic qi is primary and pathogenic factors is secondary. Between etiology or the source or the cause and manifestation, which is the symptom, etiology is primary and manifestation is secondary. In localization of lesion, the internal portion is primary while the external is secondary. In the clinical course of disease, origin is primary and complication is secondary. So in summary, symptom is phenomenon and secondary aspect, while root cause is nature and primary aspect. There is an analogy to a tree where the roots of the tree represents the causes. There could be lung, spleen, heart, kidney, pericardium, or liver disharmony, and which could manifest as constipation, headache, neck pain, earache, shoulder pain, sore throat, and dizziness. The primary or root cause should be found first. If symptoms are acute, it should be treated first. If symptoms and root cause are both serious, both should be taken into account at the same time. Some diseases, although symptoms are different, etiology, pathogenesis are the same, so they can be treated by the same method. Example, sore throat due to kidney yin deficiency and low back pain due to kidney yin deficiency, the treatment would be the same, which is to nourish the kidney yin. This is treating different diseases with the same method. For diseases with similar symptoms, different etiologies, different methods are used to treat the root cause. Example, headache due to liver yang hyperactivity is treated by nourishing yin to reduce yang. But headache caused by both qi and blood deficiency is treated by reinforcing qi and blood. Headache caused by invasion of meridians by wind cold could be treated by diminishing wind cold. So treating the same diseases with different methods.
Okay po, mayroon po kayong sound.
Here are examples of basic TCM diagnosis headache. One is temporal headache, which is a Shaoyang disharmony, which could be also treated with GB41. A vertex headache could be attributed to the liver or a Julian headache. And we could use liver 3 for this one. Occipital headache is a Taiyang headache. It's attributed to the bladder, so we could use bladder 65. A tight band headache is usually caused by phlegm, so we could use stomach 40. Heavy headaches are usually manifestation of dampness. Local and splitting headache are due to blood stasis, so we could do bloodletting in the ear epiths for this one. Frontal or orbital headaches, or the Yangming headache, we could use stomach 43. The whole head headache or the qi and blood headache deficiency is also one kind of headache. Very critical symptoms, if not treated immediately, shall affect treatment of root cause or could cause death. Use the principle of treating symptoms first when acute and treating root cause when symptoms relieved. So example, patients with chronic cough and asthma who caught common cold plus fever and has aversion to cold will have to treat the common cold first, and then after the common cold is relieved, treat chronic cough and asthma, which are primary aspect. If primary and secondary aspects are both serious, they must be treated at the same time. Prevention is an important. Wala po.
Okay po, your sound is okay.
Prevention is important aspect in treating primary aspect. Prevention before attack of disease plus prevention from deterioration after occurrence of disease. So like in the picture, it could cause domino effect. The Susan Lee or the stomach 36 is an important tonifying point. So moxibustion to stomach 36 is good for preserving health and preventing diseases. So here is a diagram of how to locate stomach 36. Locate the kneecap first and then measure one hand width down. From the tibia, measure one finger width out, and that's the location of stomach 36. During prevention and treatment of diseases, doctors are requested to know laws of their occurrence and development and ways of their transmission. If illness is going to invade other meridians, needle foot Yangming meridian to stop development, and that is the stomach meridian. So that's all for now. Thank you for listening.
Thank you very much, Mom Lynn. That was very helpful. Let's now call once again Mom Nitsu, certified acupuncturist of Silang Cavite, to discuss the controlling cycle. Good afternoon po ulit, Ma'am Nits.
Good afternoon po ulit, Doc Hector and everyone. So, controlling cycle po tayo. The mother-son cycle and the controlling cycle both function as part of the deep energy circulation, which means yung polarity ng energy remains the same as it is from where it starts, no matter where it flows to. This means that if the kidney was in excess, it has the possibility to flow to the urinary bladder, which is coupled yang organ, to the liver, which is the sun yin organ, and to the small intestine and triple warmer organ, the two young organs controlled by the kidneys, okay? Whichever organ this excess yin flows into, it will remain as yin and increase the yin energy of these organs as well. This is necessary as it is only possible to control yang with yin and vice versa. If kidney yin flows into the fire element and changes to yang, then it cannot control the fire. It needs to retain its polarity in order to carry out its control function, okay? There is a note here, a word of caution. When using the mother points as tonification point, it is important not to forget that these points tonify both yin and yang energies, even though they co-tonify more of the house energy or the yin energy for yin organ and yang energy for yang organ, okay? This may sometimes cause certain problems. For example, in a patient who has dry eyes with a tendency to conjunctivitis, or a patient with chronic insomnia who can be quite anxious and excitable, okay? Remember po, yung note. So, the following explanation of the function of controlling cycle is very exact and technical. Please take some time to understand it, as it will be very useful for energy balancing. So, explanation po dito po sa susunod na slide. Okay? We have representation of both fire and water in the body. Yung fire element has its yin and yang organs, and it is the yang organ that more represents the fire. And the water element has its yin and yang organs as well. And it is the yin organ that more represents the water than the yang organ. So, when we say that water controls fire, we mean that the kidney controls the small intestine and the triple warmer. This also means that there should be an energy flow between the kidney and the small intestine and the triple warmer, okay? The kidney has its yin and yang. The yin represents the water, whereas the yang represents the movement of water. The small intestine has its yin and yang. Yang represents the fire, while the yin represents the core or the substance that makes the fire. When kidney yin is deficient, there is less water available to flow to the fire, especially to the small intestine. This can cause chronic heat symptoms in the small intestine, sorry, such as colicky pains, yung mga symptoms yan, colicky pains with winds, urgency to defecate, or pain following consumption of coffee or alcohol. It can also cause symptoms of heart-yang excess, katulad sa mga hyperactivity ng mga bata, menopausal hot flashes sa mga babae, insomnia and tachycardia, and etc. So, the treatment is to balance the fire with hard fire. Yun yung low connecting point. And SI4 sedation, yung U1 source point. And to tonify kidney yin with kidney 7 and water by avoiding also caffeine, mga coffee, or tea, and diuretic drinks. Yan po. Thank you very much, everyone. Thank you po.
Thank you very much, Ma'am Neets. We call once again Ma'am Lean for meridian theory. Good afternoon po, Ma'am Lean ulit.
Good afternoon ulit. We're on to the next topic on the meridian theory, the triple warmer meridian of hand lesser yang. The triple warmer meridian begins at the ulnar side of the ring fingernail and flows to the dorsum of wrist and onwards to the olecranon, or the tip of the ulna. From there, it flows to the lateral side of shoulder and along the trapezius to the base of the ear. It follows closely around the ear from its base to the top and finishes at the lateral end of the eyebrow. Inner branch goes to the pericardium and the three warmers. The auricular branch enters the ear and connects with GB1 at the temple. So let's start with triple warmer point 1. Location is on the ring finger, point 1 soon, from the ulnar corner of the nail. This is the entry point of the meridian where energy flows in from the pericardium. It is the metal point of the meridian and can be used as a sedation point for young when sedated. Following is the triple warmer 2. It is located between the little finger and ring finger, proximal to the margin of the web. This is the water point and used to tonify the yin of the meridian as the grandmother point. Next is triple warmer 3. On the dorsum of the hand, in a depression between the 4th and 5th metacarpal bones, proximal to the metacarpophalangeal joints. Triple warmer 3 is located at the junction between the heads and shafts of 2 metacarpal bones. The tonification point and wood point of the channel. This tonifies more of the yang and less of the yin. Next is triple warmer 4. It is located on the dorsum of the wrist, above the wrist joint space, dorsal wrist crease, in the gap between the tendons of the extensor digitorum on the ulnar aspect and the extensor digiti minimi muscles on the radial aspect. This point is the Yuan source point of the triple warmer. It can be used as a sedation technique. It can be used with sedation technique and in conjunction with the Lu connecting point of the pericardium, which is pericardium 6. This is all for now. We'll continue with the triple warmer meridian tomorrow. Thank you for listening.
Thank you very much, Ma'am Lynn. We now come to the last topic for today. We are still on chest painful obstruction syndrome. We are now going to discuss prognosis and prevention. Acupuncture and Chinese herbs are effective, but the treatment will necessarily take several months, if not longer. The most difficult types to treat are those from phlegm and blood stasis. Tongue body color gives a good indication for prognosis. The more purple the tongue body, the more difficult it will be to treat. Prognosis depends also on the Western differentiation. Ischemic heart disease from an atheroma obstructing a coronary vessel and carcinoma of the lung are obviously the most difficult, if not impossible, to treat. Even if the patient needs a bypass because of blocked coronary arteries, Chinese medicine does have a role to play after the operation. The operation may successfully establish coronary circulation with a bypass, but it does not eliminate the original causes of the problem. That is, it does not resolve phlegm, invigorate blood, expel cold, or tonify yang. Therefore, the use of TCM after a coronary bypass helps the patient to improve his quality of life and most of all, prevent a recurrence of the coronary obstruction. As for prevention, the patient should take regular exercise that is not too strenuous. Chest painful obstruction is caused by stagnation of qi, blood, cold, or by phlegm, and all such conditions improve with moderate exercise. Brisk walking is an excellent exercise, and for those who have access to a teacher, Tai Chi Chuan or Qigong is ideal. It is important not to eat dairy products or greasy fried foods, which lead to production of phlegm, because this obstructs the chest and interacts with blood stasis. If the patient is a smoker, it is absolutely vital that he stops. Smoking is detrimental to chest painful obstruction, not only from a Western, but also from a Chinese point of view. From a Western perspective, nicotine contracts the blood vessels and would therefore aggravate blood stasis. From a Chinese viewpoint, tobacco is a toxic substance that is hot and drying, dries up blood in the vessels, which will contribute to development of blood stasis. Impairment in circulation of qi and blood. At the root of the development of the disease is qi stagnation. and qi stagnation will lead to blood stasis in time. Qi stagnation will not only lead to blood stasis, but is also the beginning process of disharmonies. For example, as qi stagnates, stomach qi will fail to descend and spleen qi will fail to ascend, and this will lead to formation of phlegm in time. A dysfunction of the stomach and spleen is usually the root for the formation of phlegm. A deficiency of heart qi and heart yang means that clear yang fails to ascend to the chest and turbid yin fails to descend. As a result, phlegm and turbidity settle in the chest, leading to coronary heart disease, manifesting with feeling of oppression in the chest. In the pathology of coronary heart disease, stomach qi fails to descend and spleen qi fails to ascend. Liver qi stagnates and may ascend in the form of liver yang rising. There may be insufficient rising of the physiological liver qi. Kidney qi fails to transform fluids, heart and kidneys fail to communicate. The basic differentiation in the pathology of coronary heart disease is that between full and empty. Empty conditions include deficiency of qi, yang, blood, or yin. When the empty aspect predominates, there is not much chest pain. So kung papipiliin kayo, mas mabuti empty. And there's only a slight feeling of stuffiness of the chest. Among the full conditions, main differentiation is that between dampness and phlegm. Okay, there are very few other doctors who consider dampness as an important factor in the pathology of coronary heart disease. Dr. Deng says that dampness in coronary heart disease manifests with feeling of oppression and pain of the chest, being worse from exposure to damp weather. So try going to Europe. So you might aggravate the problem. A feeling of fullness in the epigastrium, sticky taste, feeling of heaviness of the head and limbs, turbid urine, sticky tongue coating. So Dr. Deng advocates strengthening the heart, regulate the spleen, benefiting qi, and resolving phlegm. Thank you very much for your attention. Thank you for joining us, and we hope to see you again next time. Thank you, po.